Hello, my name is Mari Baez and I'm going to be doing discussion 6, euthanasia. So the first question is euthanasia very ethical? When is it ethical? Is there a difference between passive and active euthanasia? So I believe that it could be ethical in the sense that if you know the person is suffering, all they do is wake up, they're in pain, that they're just not enjoying life, like they just are depressed and basically all they do is suffer. I believe that it could be ethical if they have no way in of recovering from whatever illness they have. Is there a difference? The difference between passive is when they usually have a treatment, and I believe is the treatment doesn't work, so we completely stop the treatment, making like the illness just take over little by little, and that will result eventually in like the person's death, passing away. And active, it would be um, when the doctor takes their life, like not take their life, but help them die, basically. Do you believe someone has the right to terminate their life? Why or why not? In which situations, if any, does a person have the right and why? I believe the person should have like a decision, but there should be like documentation before, like testing before, knowing that there really isn't any any way of recovering from whatever illness they could have, and if they're mentally stable to go through the process of dying. If they're asking to die, excuse me, if they're asking to die, I believe that there should be mentally fit to make that decision, or their guardian should be mentally fit to make that decision. In which situations, again, the situation that I would say is when there's suffering, there's no more enjoyment, and yeah, basically that. Was it with Dr. Kevorkian? Do you believe it was right that he should have gone to prison? Why or why not? Is he a bad person or a savior? Why? He shouldn't have gone to prison. Um, in the sense that it was his patient's request, and I believe there should have been any type of like documentation before, like I mentioned a little bit ago. But what I don't believe is that doctors need to grant the patient's wishes, because sometimes it's not the right wish. I believe if you're a doctor, is you're committing to saving lives, not ending them. So when he said that it was his only job was to grant wishes, I wasn't really sure. Like I didn't completely agree to that. Um, I don't believe he's a bad person though. Maybe he did know that the person really was suffering, that they didn't look forward to anything in life, and yeah, maybe he actually did help in some type of way. And what are your thoughts on the Terry case? Do you think she would have been nice like she was? Why or why not? So in that case, it was she was in a vegetable stage. Uh, there was nothing that they could do so she could come back, and that happened. That's what her husband realized throughout the years. Um, that she wasn't gonna come back. That it was probably um, just nothing enjoyable to see for her, neither for him. That he would see her suffer when she was in a vegetable stage. That's I believe that in that case it would have been like the right decision. There was no progress that could have been made, and um, yeah, I believe it was the right decision to make. Thank you.